This is Nader Shah in Chicago, and you are watching my channel, Knowledge for Quality of Life. Friends, I welcome all those who have recently joined the channel and be part of this community of learning. I really welcome all of you, and I would strongly recommend to participate in the comments, giving your views, feedback, and if you have any concerns, questions regarding the material which I've been sharing here. Before I go into today's topic, which is going to be a case study, this case study based on various tests which I've been doing over the years, and the areas which stood up as a red flag or areas of concern which I needed to address, and how I did it, I'm going to be sharing with you. And this vlog is based on the APOE genotype, my case study, and I carry 3.3, which I mentioned earlier, and it's going to be based on that. And by no means this is a representative sample of that, anybody who is 3.3, they can apply all these things. You have to be mindful of it. I'm going to share with you as well that how I tweak it, based on what the general guidelines are, based on my own blood parameters. So before I do that, I strongly recommend that if you like my information and knowledge which I share here, which I impart here, please do share with your friends and family and colleagues, so that they can benefit out of it in improving their quality of life as well. So let me share my screen quickly. What you see here is my case study, and since as I said that I'm APOE genotype 3.3, so for genotype 3.3, the guidelines, the literature said that Mediterranean diet is one of the best, including fruits, vegetables, whole grains, legumes, nuts, olive oil, fish, and of course limiting processed foods and saturated fats. I modified certain areas here based on my conditions, and I'll come in a bit. So my pre-existing conditions are sort of a red flag or areas of concern, and how I mitigated it, how it was checked and addressed in a timely manner over time. So my first thing and foremost was vitamin D deficiency. My vitamin D was deficient, 20, as I said in my many vlogs, when I did my vitamin D, my entire family was down, actually deficient. So, it's very common with the color of skin, people, and, as a matter of fact, Caucasian people also, because we don't get enough sunlight, and depending on the latitude where we are. And I addressed this thing over time. I calibrated it. I did another separate vlog, how I did it. So please, I have request that, when you look at my vlogs, you have to see each vlog as a piece of the puzzle. And then you can connect the dots. Because if you see one vlog and try to get out of it something as a result, you may not get it. So I'm trying to consolidate things here as a part of the case study. So I corrected with 5,000 IU daily with cofactors like vitamin K2, magnesium, vitamin C, and probiotics in the form of yogurt. And I have risen above 60, and over time, right now I'm standing at 82. When I was deficient in D, I was getting pretty frequent cold and flu during the season. And if I get flu or cold, sometimes it used to get that bad that, I had to call sick for 3-4 days from work. And if I get infection, then I would end up taking the antibiotic. And it was not good for me. Once I fixed my D, I saw over time that, the severity of my cold and flu dwindle. And I hardly get now any severe flu or cold. If I get flu, which of course, I would get if I get it, then it would be a day or two sniffles and scratchy throat, and it will subside on its own. I don't do anything. No herbal supplements, nothing. It comes and rides out, and my immunity fights for it, and it's gone in a couple of days. But I don't get knocked out completely. My strength remains intact because remember that D is a immune modulator, which I explained in my series of vlogs. So it is very well documented over time in research. And there's a lot of misinformation about D out there, that D is going to create toxicity and all that, wrong stuff, which there's no proof to it scientifically. And in my case, when my D was 20, my calcium serum level in the blood was 9.6. When I raised 82, which is 4 folds more than 20, my calcium dropped actually 9.2. It's on the contrary, it should have been increased because your D level increases your calcium absorption by 20 folds. So my doctor was surprised, but I do K2 and I increase K2 over time from 100 microgram to about 800 microgram in my case, and I'm feeling great, excellent. And the other area of dyslipidemia was low HDL. I was always low on HDL, and I did a separate vlog on this one. My HDL was 27. After fixing my D, over time, it took 1.5 to 2 years. Not only D, avoiding all the carbs, refined carbs, avoiding all the grains, avoiding all the flours and sugars. It started moving from 27 to 38, 44, 50, 55, and finally at 60. So I'm standing at 60. So that's quite a big jump, almost 122% jump. Then my high small LDL particles were about 700. These are very atherogenic in nature, which I explained. And over time, by fixing my D, by avoiding carbs and grains and sugars, it dropped to 450. Then 450, beyond that, it wouldn't budge. Then finally, at the end of 2022, I got extra virgin olive oil in my diet, and which is loaded with polyphenols, and it dropped over time to 182 from 450. So from 700 to 182, it's quite a big drop. No statins can do it. Now, looking at these numbers, my doctor recommended cardiologist, who is the expert in dyslipidemia. He was about to give me 40 milligrams of simvastatin, and I said that give me 6 months, and I'll try to do some lifestyle modifications. And I was vividly digging the information through the literature, science literature, day and night, and many periodicals, many papers, many articles I read by well-renowned cardiologists who did things in the past with lifestyle modification. And here you go. So I dropped to 182 from 700. My triglyceride was 90, and my 90 over HDL of 27, the ratio was 3.3. It's recommended to be under 2 for better risk predictor of heart disease, and it was above 2. So it dropped here. My triglyceride dropped from 90 to 48 by avoiding all these carb and all these processed food and sugars and refined flours and everything. It dropped to 48. So now my triglyceride over HDL ratio was, standing at 0.8. It's less than 1, which is optimum, and I'm very happy. Without any drug, this is just a lifestyle modification. Make sure that you see that, and I really appreciate that the nature is amazing. It does phenomenal things. This body is just like an engine. The better fuel you put, it's going to give you a better output. Simple as that. I was low in vitamin B3 and B5 when I did the detailed micronutrient panel test. It tested all the vitamins which one can have in the body, all the minerals, all the trace minerals and everything. And the report came, everything was okay except B3 and B5. So the consultant recommended me to incorporate chicken liver in my diet, some sort of a liver, either beef liver or chicken liver. I prefer grass-fed beef liver, but it was not available in my area. So I've been buying organic chicken liver, and I'm eating twice a week, just sauteing it in with a little bit spices to make it at a flavorful 3 ounce each serving. That's it. And my B3, B5, B6, B9, B12, all the B complexes are loaded in chicken liver. Not only Bs, but all the minerals and other nutrients as well. It's a loaded food on the face of the earth, with packed off all the nutrients. So it's good stuff. Fasting blood glucose, mine was 100, and HbA1c was 5.6. I was not very happy with it. And here my insulin resistance score was 33. And if you recall that, the Cardio IQ insulin panel test from Quest Lab, 1 to 33 is insulin sensitive, 33 to 66 is somewhat insulin resistance, and above 66 is full-blown insulin resistance. So I was concerned about it. All these lifestyle modification dropped over time my insulin resistance score to 6. So I was very happy with it. Here, still I was not happy. So I asked my doctor to give me a OGTT through the literature. I digged up, and I looked at it that let's see that what the results I get from oral glucose tolerance test. That's what OGTT stands for. So on that day, I went they drew my fasting blood glucose. It came 104. They gave me a 75 grams of glucola, and I gulped it down. And after 2 hours, they checked my postprandial sugar, blood glucose. So it came 100. So anything less than 140 was normal. So I came actually after 2 hours 100, lower than my fasting blood glucose. So doctor was surprised, and he said that, Nadir, you are very insulin sensitive, so don't worry about anything. So it came out okay. Still, I was not happy. I wanted to check another marker. In fact, 2 markers, fasting insulin, and I had another test for fasting blood glucose. It was 100. They checked my fasting insulin in that test. It was 300 and 3. I'm sorry. And then I calculated HOMA-IR with this formula: 100 times 3 divided by 405. This is based on US units. So it came out 0.74 is less than 1.5. Anything less than 1.5 is insulin sensitive on a HOMA-IR scale. So it came out okay. Then I needed to check my C-peptide. This is a pancreas output, that how my pancreas is well managing my insulin output. So it came out 1.03, and that is less than 2.17. That's a Quest Lab range, and it came out okay. So I was okay. Then another area of concern was coronary artery score, which we call calcium scan score. First time I did it in 2018, it came as 98. Then I ran another, after 3 years, it came 169. It's about 15% increase per year. So I was concerned, and I was doing everything possibly I can have access to, but at that time, I was incorporating only vitamin K2, MK7 of 100 micrograms only. And based on my APOE genotype, I'm typical clearance, which I shared a few vlogs that, vitamin K2 is cleared differently based on our genotype. So I was okay in typical clearance. I was not a concern at all that, I'm going to back it up. So I increased my vitamin K2 intake from 100 to 500, and I incorporated my homemade natto, which I make. And I made a separate vlog how to make natto. And 1 tablespoon of natto has about 150 microgram of vitamin K2 MK7. Besides natto kinase, which is an enzyme, it lowers your fibrin level. It keeps your blood thin. It's anti-clotting and anti-thrombotic as well. It's good stuff. Excellent if you can, enjoy the taste. So 500 plus 300 is about 800 micrograms, and I've been consuming since then 800 micrograms. So I ran another KEC score in 2024 with increasing vitamin K2, and I was very happy to see that my score didn't go up, so it stopped. So I'm planning another KEC score in 2027 and see where I'm standing, and I'll keep you posted. Then I was concerned, since I had a KEC score, I wanted to see how my carotid arteries are. Is there any stenosis? Is there any blockage? And they ran the carotid Doppler, and they didn't find any stenosis whatsoever. So it's clean, so I was very happy. So let me share my screen here. So all these individual bits and pieces of elements I consolidated in this vlog, and I remember that Mediterranean diet is okay for APOE genotype 3, but I didn't include the whole grains. I excluded that part because I had an issue of small LDLP and sugars, refined carbs, grains. All these tends to increase your triglyceride, and if you're increasing to your triglyceride, and that is going to increase your small LDL particles as well, because triglyceride and small LDL particle, they go hand in hand. If you reduce one, the other one is going to lower down. If you increase one, the other one is going to go up too. So it's a double whammy. So I had to modify that portion of the Mediterranean diet. And of course, I'm not eating any processed food, as I mentioned in that sheet which I shared with you. And I'm enjoying a little bit saturated fat, very limited, not a whole lot. But I'm okay. I can consume saturated fat. It's not a no, but it's a limiting amount. So I just wanted to share this concept with you in a wider picture, and make sure that you don't try to replicate exactly, if you are 3-3, what I'm sharing here, because you may be a little bit different than my parameters. You have to see the whole picture of your blood work. And I've shared in one of the vlog detailed blood testing, which I do about 30-35 tests. And once you have the big picture and see what things are and where you are standing, then you can start fine-tuning those things and see where you are standing in the bigger picture, and how you can address accordingly. So I hope that you get something out of it. And if you have any particular questions, concerns regarding this, please do comment in the comment section, and I'll try to address in the next week or week after. And if I get enough comments, then I may do a certain vlog which address all those comments. Okay, so next week I'm going to be sharing a case study of my wife, which is APOE3/4. She has different set of parameters. She has different issues, and how we are mitigating that. Remember, two folks are not identical. I've been saying all over this time, right? So we have to dial in each one of us individually, separately. And I wanted to give you this footprint, so to speak, that guideline, that how to analyze. So consider this as a tool. It's not a hammer that you can hit it at each and every nail accordingly. This is a guideline. So I wanted to educate you enough that how to use the tools which are at our disposal, and do some lifestyle modification and go from there. I hope you enjoy it, and see you next time.